So coagulants. Coagulants are agents that help promote the coagulation of blood. This means that they are substances that help particles in liquid to curdle and clot together and are mainly used to remove colloidal impurities, suspended particles such as bacteria, clay, silts, and organic material from the contaminated water. The various coagulants are as follows. So the first is thromboplastin. Thromboplastin is a mixture of both phospholipids and tissue factor found in plasma, aiding blood coagulation through catalyzing the conversion of prothrombin to thrombin. It is produced naturally by platelets and damaged tissue, but commercial thromboplastin are extracted from cattle brain in normal saline. It is applied locally as a hemostatic in capillary oozing in the treatment of epistaxis. The next is thrombin. Thrombin is a unique molecule that functions both as a procoagulant and an anticoagulant. In its procoagulant role, it activates platelets through its receptors on the platelets. It regulates its own generation by activating coagulant factors 5, 8, and even 11, resulting in a burst of thrombin formation. It is an enzyme which converts fibrinogen into fibrin. Bovine thrombin is a powder supplied with suitable diluent and is used in arresting capillary hemorrhage and in conjunction with fibrinogen or fibrin foam for this purpose. Next is fibrinogen. Fibrinogen is a protein produced by the liver which helps to stop bleeding by helping blood clots to form. A test can be done to tell how much fibrinogen you have in your blood. It is used in assisting the adhesion of grafts of skin and mucous membrane as a 2% solution. Next is fibrin. Fibrin is a tough protein substance that is arranged in long fibrous chains. It is formed from fibrinogen. When tissue damage occurs, results in bleeding, fibrinogen is converted at the wound into fibrin by the action of thrombin, a clotting enzyme. Commercial fibrin is available as fibrin foam in the forms of strips or a fine white sponge. These strips are soaked in thrombin solution and placed over the site of hemorrhage or in the cavity, and coagulation occurs immediately after that. Next is oxidized cellulose. Oxidized cellulose is usually used to stop bleeding in the spine surgery and to pack cavities or lytic defects. It should be applied dry, and when it swells, forms a brown gelatinous mass which may take about 7 days or more to be absorbed. Calcium alginate. Calcium alginate is a water-insoluble gelatinous cream-colored substance that can be created through the addition of aqueous calcium chloride to aqueous sodium alginate. It is also used for entrapment of enzymes and forming artificial seeds in plant tissue culture. This consists of calcium or a mixture of calcium and sodium alginates and is an absorbable hemostatic. Next is the absorbable gelatin sponge, which can also be called gel foam sponge. It is a medical device intended for application to bleeding surfaces. This is prepared from gelatin and treated with formaldehyde, heated, whisked into a foam, and freeze-dried. This sponge is insoluble in water but can be wetted.
Hello guys, for today's topic is all about the hematinics, the coagulants, and anticoagulants. Hematinics are agents that are used in the treatment of anemia and generally act by stimulation of hemoglobin synthesis of erythropoiesis. The main hematinics are the iron, copper, cobalt, vitamin B12, erythropoietin, folic acid, and anabolic steroids. Deficiency in hematinics can lead to anemia. Iron is important for hemoglobin formation. However, often it is supplemented for the treatment of deficiency of iron by giving as oral or parenteral preparation. Oral preparation should be supplied as ferrous sulfate, gluconate, and fumarate. The usual dose is 100 to 300 mg per kilogram for dogs and 50 to 100 mg per kilogram for cats. Parenteral preparations can be administered if oral preparations are not feasible. Iron bixoctron can be given as single injection at 2 to 3 days of age in neonatal pigs. For the copper, it is utilized as a cofactor in the synthesis of hemoglobin. Copper deficiency is treated by administering copper-containing salts such as copper sulfate or copper glycinate. For the cobalt, it is utilized for the synthesis of vitamin B12. Supplementation is by sulfate or chloride of cobalt at 0.2 to 0.5 gram per day for cattle or 0.05 to 0.1 gram per day for sow through feed or oral drenching. Folic acid is also important for the synthesis of DNA and RNA and the synthesis of red blood cells. Anemia due to folic acid deficiency is also called megaloblastic anemia. Folic acid is also available by diet from yeast, liver, vegetables, and many more. Supplementation of folic acid can be given as oral supplements at 2 to 5 mg per day per kilogram. Vitamin B12. It is essential for the DNA synthesis because deficiency of vitamin B12 causes nuclear maturation and division and causes pernicious anemia. Supplementation is given by parenteral preparations of cyanocobalamin at 2 to 5 mg per kilogram. Erythropoietin is essential for normal erythropoiesis as it acts on bone marrow to stimulate erythropoiesis. Erythropoietin is indicated in anemia due to chronic renal failure. The synthetic form of erythropoietin, a poietin alpha, is available and is given subcutaneous injections. For the last one, the anabolic steroids are testosterone-like compounds with protein anabolic activity. They increase circulating red blood cell mass and indicated in chronic non-regenerative anemias. Nandrolone, stanozolol are products that are available to be given by oral route.
Hello guys, so today we are going to talk about anticoagulants, specifically in vitro anticoagulants. Anticoagulants are medications that help prevent or delay blood from thickening or clotting. It is sometimes called blood thinners. But anticoagulants don't actually thin blood, they just simply interrupt body's natural clotting process. They can be classified as in vivo and in vitro anticoagulants. But today we are just going to talk about in vitro anticoagulants. The in vitro anticoagulants are useful in the collection of blood for laboratory analysis or for blood transfusion. So now I am going to give you some example of anticoagulants that use in laboratory. Anticoagulant number 1, double oxalate. This anticoagulant removes the free calcium ion from solution through the addition of ammonium and potassium oxalate. Calcium is precipitated as insoluble calcium oxalate. For its uses, the blood taken into this anticoagulant is unsuitable for morphological examination. The red cells commence to crenate and the white exhibit bizarre nuclear pattern. Anticoagulant number 2, ethylene diamine tetraacetic acid or the EDTA. EDTA can be found in 3 salt forms, which are the tripotassium EDTA, disodium EDTA, and the dilithium EDTA. EDTA acts by chelating or removing ionized calcium. Since calcium is required for blood to clot, so when it is removed, the blood will not clot. EDTA is the most commonly used anticoagulant in the hematology laboratory. Anticoagulant number 3, heparin. Heparin is an acid mucopolysaccharide. It acts by complexing with antithrombin to prevent blood clotting. Antithrombin is one of the natural or physiological inhibitors of blood coagulation. And lastly, anticoagulant number 4 is the sodium citrate. This is the most commonly used anticoagulant, mainly used to prepare citrated plasma for the evaluation of coagulation disorders, as it is not inhibitory to calcium ions. And now for the anticoagulants useful for blood transfusion. We have 2 examples here. And the first one is the acid citrate dextrose. It is one of the most important anticoagulants that is employed for the stored blood because it does not allow the blood to coagulate. it inhibits the action of the binding of the calcium ions, which is one of the factors for coagulation. And the next one is the citrate phosphate dextrose. CPD has the following advantages for blood preservation. First is isotonicity for red blood cells, thus minimizing the lesion of collection and resulting in improved red blood cell survival. Second, more physiological pH, 15% less citrate ion, and it improves red blood cell oxygen transport.
So next is the systemic anticoagulants, in vivo anticoagulants. So heparin is used in both as in vivo and vitro anticoagulant. It has a direct and almost instantaneous action on the coagulation process. So heparin is a drug that is used to prevent or treat a variety of blood vessel, heart and lung diseases. It is also used in open surgery, bypass surgery, kidney dialysis, and blood transfusions to avoid blood clotting. Heparin is present in mast cells along with histamine and serotonin and is prepared commercially from bovine, lung, and porcine intestinal mucosa. So mast cells have a central function in allergic and inflammatory diseases and contribute to increased vascular permeability, allergic and anaphylactic reactions. So the heparin prolongs the clotting time of blood both in vivo and in vitro and prevents the fibrin formation in the process of coagulation. Heparin decreases the aldosterone secretion and increases the concentration of free dioxin, where it slows the wound healing and depresses cell-mediated immunity. So in the clinical uses of anticoagulants were the prophylaxis and treatment of venous, thrombosis and pulmonary edema, and the diagnosis of treatment of chronic consumptive coagulopathies. Anticoagulants are drugs that prevent blood clots from forming. They are given to those who have a high risk of blood clots to help them avoid catastrophic diseases, including strokes and heart attacks. Anticoagulants work by interrupting the process involved in the formation of blood clots. They're sometimes referred to as blood thinning medications, despite the fact that they don't actually make the blood.
Coumarin derivatives. Coumarin derivatives are anticoagulants that prohibit vitamin K from working as a cofactor in the formation of vitamin K-dependent coagulation components in the liver. This is found in some sweet clover species and has no anticoagulant properties. Derivatives includes ikomarole. Ikomarole is an anticoagulant substance found in nature that depletes vitamin K reserves, and another one is the warfarin. This is a medication that is used as an anticoagulant, which are both common derivatives. Warfarin sodium is a drug of choice. Vitamin K antagonists are substances that inhibit the absorption of vitamin K. It takes them roughly 8 to 12 hours to complete their action. They are commonly used in the treatment of venous thrombosis and pulmonary embolism as a secondary prophylactic measure. Anticoagulant response is increased by aspirin, cimetidine, phenylbutazone, oxyphenbutazone, cotrimazole, metronidazole, and disulfiram. Heparin antagonists. Heparin antagonists are substances that stop heparin from working as an anticoagulant. They could be used to treat heparin overdosage. Protamine is antagonist to heparin. So, protamines are simple proteins that can be found in the sperm of a variety of animals. Protamine sulfate is a low molecular weight, highly basic protein derived from the sperm of some fish. It neutralizes heparin on a weight-for-weight basis when given intravenously. Protamine sulfate works as a mild anticoagulant in the absence of heparin. Also, protamine sulfate is a blood factor used to reverse heparin's anticoagulant action and to treat heparin overdose.